Our next guest is a renowned community health activist who was awarded the President of Convocation Medal in 2017. She has worked for more than 20 years in health clinics and hospitals in several countries across Southern Africa. Please welcome the Executive Director at the National Institute for Occupational Health, Dr. SOPHIA Kisting CAIRNCROSS. Thank you for joining us today, Dr. Kisting CAIRNCROSS.
Good afternoon.
SOPHIA, your life's work has been about protecting the health of some of the most vulnerable in the world. How did your background and your work in hospitals spark your passion for environmental justice?
Thank you very much. And I grew up in distant rural desert landscapes in Southern Africa, in Namibia, in fact. And that had a profound impact on my understanding of the interconnectedness of the environment and health outcomes. I studied medicine because I was influenced by that very environment and that background, and became increasingly aware of the enormous inequalities with regards to health outcomes that we faced as doctors within the health services under the then apartheid regime. As such, it became very clear, especially as my focus have been on workplaces and the health of working people in particular, it became more and more clear to me that it is not only workers at workplaces who are exposed to adverse health conditions who get sick, but the very workplaces who don't protect the health of workers also make the environment very sick for community members living there. It therefore became imperative to find ways through workplaces to protect the environment. And that has been really one of the driving forces within my life, because unless in public health we find ways to have the upstream preventive interventions, we will never be able to ameliorate the adverse health outcomes and the consequences of the severe occupational and environmental conditions that many of our people are subjected to.
And occupational health definitely plays a role in the climate crisis. Tell us more about the direct impacts the climate crisis is having on public health. And what impact does the burning of fossil fuels have on health?
Yeah. Climate change has significantly impacted public health. Essentially, we face heat waves more and more frequently. We face storms much more severe than we have seen before. We face fires repeatedly, sometimes in areas where we just have not had that before. And all this worsen the conditions under which people live. So these climatic changes have an impact on health in many different ways. If just from the occupational perspective, workers who work in agriculture, in fields, workers who have to put on telegraphic poles, workers who have to be out there, whether it be in the sugarcane fields or growing crops and so on, they have very little protection from these increased heat waves, and therefore have problems related to excess heat, also kidney problems and skin-related problems. Then you have the major problems related to the fact that climate change impact heart diseases, more myocardial infarctions and so on. It also impacts respiratory diseases, worsening of asthma, worsening of chronic bronchitis, and so on. And I think I want to mention one of the health outcomes that's often not looked at in our situation with regards to climate change and the use of fossil fuels is that coal dust contains silica dust. And silica dust in our context predisposes the workers in the communities to more tuberculosis, so the spread of that infectious disease is most certainly impacted by our use of fossil fuels, if not directly through climate change. Other problems, especially for us in Africa, where we have many vulnerable populations, will find that infectious diseases, most certainly such as malaria, will be impacted, and problems such as tick-related problems such as Zika, certainly we need to be on the lookout that may be a problem as well in future. So certainly both climate change and the utilization of fossil fuels for energy has a profound impact on public health, and it often goes unrecognized.
You specifically mentioned coal mining and its effect on occupational health. Well, there's a fear that people face, and it's not just in South Africa, but all over the world, that if we move away from fossil fuels, there won't be as much job opportunity. In reality, we know that this fear is simply not true. So how do we combat that type of thinking?
Well, I think there are a number of things that we can do, and we need to find ways to be part of the solution. Coming from Africa and knowing and being a daughter of Africa and having been a doctor in many of our hospitals throughout Africa, we know the importance of having a job, and we know the importance of being sick. So in the high levels of unemployment, one can fully understand the uncertainty about losing a job if we cannot work in the coal mines anymore, if we cannot work in the transport of coals and all the other jobs that's related to coal mining and the utilization of coal for energy, which is very high certainly in our country here in South Africa. But we must weigh up the health impacts, which are enormous. Coal workers' pneumoconiosis is akin to silicosis, which is a major problem in our country. We have not been able to control silicosis outcomes. We know that coal dust contains silica dust, and that it predisposes to TB, which cripple many of workers within the mining industry, but also in the construction industry and beyond. And so it is imperative, it is incumbent on us, and especially I would imagine those of us who see the health outcome of the utilization of fossil fuels, that we advocate the use of clean, renewable energy sources. And we certainly have an abundance of it, as you can see the sunshine here in our city of Johannesburg. And we have a coastline that is very enormous for wind energy. And so there are possibilities. However, what is essential is that we must have a very strategic approach of just transition, where together with governments and workers and the society at large, we need to find the common ground and work together and say we can have the strategy to work out so that we can invest in renewable energy, transition to renewable energy, and that will not have in any way result in job losses. There has been an assessment done indicating that if we, especially in the manufacturing with regards to the renewable energy sources, we can create about 250,000 jobs. And we have to look at that. It doesn't mean that because we need a job, working people must sacrifice their health. Our health burden already is enormous. And not often is the cause between the exposure and the adverse health outcome fully demonstrated. So I think we need to work on that. We need to reassure our entire communities in Africa that there will not be job losses if we transition more and more to clean, renewable energy sources. It's imperative on us to do that, to spread that information, and to give that reassurance.
It sounds like that transition is beginning to be underway. Dr. Kisting Cairncross, I want to thank you so much for all of the work that you do in this area in securing public health for South Africans and all Africans. And thank you for sharing your perspective today on 24 Hours of Reality.